Here's a medical thing they don't tell you. Certain insurances slow down cancer diagnoses because they won't reimburse for things that are done in the hospital. They'll wait for things to be done outside of the hospital. So what usually happens in this context is a patient comes in, they've been coughing, you do imaging, CT scan, you find out they have a lung mass. You want to biopsy the lung mass, which sometimes you might be able to pull off in the hospital, but to send off that biopsy sample for next generation sequencing or genetics, basically to tell you what the best chemotherapy or immunotherapy would be, that might not be able to get done in the hospital because insurance won't reimburse for it. So you have to wait for them to leave the hospital to then send for the genetics. And then the patient might be stuck in the hospital for 2 weeks anyhow, so you still cannot send the genetics report until they leave. So once they leave in 2 weeks, then you finally send the genetics report, but then that also takes another week to 2 weeks to result. So instead of having a result while they're in the hospital, you just effectively delay things